Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hannah
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin.
Hi everyone!
Welcome to next episode.
So today it is all about how dental hygiene can impact your overall health.
And I love this topic because this is where a lot is starting, and it's where we can help a lot. So I say to all of my clients, imagine that all the pathogens in your mouth, they are circulating in your bloodstream, and they would approach the weakest system of what you actually is weakened in your body. So either it's an organ, or it's an ankle, or it's a trauma after exercise.
So how is it then that everything is connected to everything? How is it then some tooth can influence our knee or thyroid gland or kidney? So basically, traditional Chinese medicine show us and, giving us examples that everything in our body lies on a path. So every single tooth actually has a path which influences organs, it influences parts of the spine, it influences glands, and basically everything what we've got in our body. So it is then magical when we see, and if we are just going to be talking about the dental hygiene today, so when we see a person, and I can recall a person who came over with a deep inflammation in her front tooth. And by the way, I was asking, what's happening in your life? Is there any issues you're complaining about? And she said, as a matter of fact, I keep having urinary problems, like bladder problems, and they keep giving me antibiotics for it. And I wasn't surprised because I saw this deep inflammation in her gum in one of her front teeth. And so what I then explained that this might have a connection because this particular tooth is lying on a meridian of a urogenital tract, which is exactly kidney, bladder, and reproductive organs as well. So what happened then, we have, looked after the issue. She went through several rounds of deep scaling, so treatment of the gums. We used ozone, we used supplementation, and she has recovered not only her gum, but her urinary problems are gone as well, which was amazing. And that's something what we'd like to share today in this episode, how everything is connected and how your teeth, and not only the teeth in terms of tooth as in a tooth, but also the surroundings of the tooth can influence your overall health. And today it's all about gums and inflammation.
And we will start straight there. So the supporting tissues are called gums. And I would like to say how the healthy gums look, and then we will just reflect how the unhealthy gum looks and what would happen if it's unhealthy. So healthy gums are nice, pink, almost whitish, pinkish gums. They're beautifully leaning towards the neck of the teeth, and there is no swelling, there is no bleeding, and there is no pain. So just slightest bleeding or slightest sensitivity is showing us inflammation. And we call it gingivitis, which is the inflammation of the gums. If this inflammation goes further, and I always explain to clients, if the toxicity of the bacteria which are actually causing this inflammation, if it's severe and if the body doesn't have the immune system to attack or to kind of deal with that, then it goes beyond the gum tissue, which is the pinkish part, and it goes below where is the bone, which is the supportive tissue to hold on the teeth. And the toxicity, the acidity would destroy the bone, and you're losing the level of the bone, and then the teeth, they would start being loose. So,
Yeah,
and that's called periodontitis.
exactly. And in other words, just I know that it is maybe difficult when we're speaking, we cannot show you. That best example is to show you guys in a dental chair, but you're not with us right now. But what I'm doing with my clients when they come over for initial assessment, I always start with a gum evaluation and showing them how, the healthy gums look. So I always find a spot where there is like at least a little bit of healthy gums and show them how it's supposed to look versus how it's not supposed to look. So what Eva said, that's exactly the bleeding, swelling, sensitivity, sometimes even pus coming through, redness as
And
well,
no,
right?
many people would realize that gum disease is actually the most common bacterial infection
And disease.
and disease.
And sadly enough, most people don't consider it as a disease, but it's the most common disease in the world. But we're here beyond this. We're gonna discuss today why is it happening. And it is not about brushing and flossing only.
It's part of it.
It's part of it. We're just going to be talking about emotions. We're just going to be talking about stress levels.
And nutrition and supplementation.
Exactly.
So I stopped saying, like years ago, I was saying the number one was prevention and brushing and flossing. But for me, and I think we joined that opinion, the first biggest influence on our gums, and it does reflect it, how they look, is the emotions.
And not only
And
gums,
stress levels.
like the overall well-being of the body. Like everyone knows, like when they're fall in love or when they're on vacation, everyone's happy, everything's beautiful, they don't need to eat, they don't need to sleep. Yeah. And, like you kind of in this beautiful frequency almost. And
full of oxytocin, which is great.
Yeah, full of the happy hormones, which is great. But with the gums, I just kind of lost where I was going through that.
Hannah, with the gums, we see a lot that even though clients have great hygiene, they can come back and it does reflect the state of their life. So if there is something, changing work, issues in the family, relationships, they would have signs of inflammation, which is swelling, pain, bleeding, and that the gums are very red and they don't look healthy. So that's emotions and stress levels.
And that's probably why we want to discuss this, because we would like to open the doors for you guys who are not aware of this fact, that this contributes to your gum issues. Like our very first, I don't know why I just remember this, but maybe we're just going to share it. Our very first interaction with this kind of work was like years and years ago when we arrived to Brno and we signed up for a family constellations. I'm jumping totally in a different field.
Yeah, but that's how we want to inspire you, because it's just a holistic way of healing the body and the soul.
So basically family constellations are like an energy healing modality where, there's a person who who is leading through it, and based on energy, he set up a constellation. So I'm just going to say the example, what I want to say. We arrived in one of those sessions, and there's about 40 people. And one of the first person who was talking was young mom who was saying, I'd like to talk about today and see what's happening with my daughter who has severe gum issues. And she's been on several treatments. She's had several antibiotics and nothing is working, and honestly don't know what it is. And I'd like to help, and I'd like to see it from the energy point of view. And we were like, we opened our mouths because we're two dentists
okay,
there.
That's why we are here. So we were just listening closely.
But my first thought was like, why is she asking this here? Because I've never been to family constellations then, so I didn't know what it is about. But then it was just like eye-opening how the emotions,
the family matters, they really create the illness.
Yeah. So this little girl, she's I think 10 or 11. Mm-hmm. And then it turned up that her mom and her dad, they do have arguments in between each other. And
I think it was the way, Hannah, that these two people, they conceived, but the dad, he didn't stay with the family.
Right.
And mom was angry about it past these 10 years or 11 years. So she didn't forgive him. And that in that constellation, it was shown that she has to forgive. And this is like why the daughter is taking, or she's having these severe gum inflammation, which is in this age very rare, very rare.
Which is rare, and it
So
is
such a good mom, she came to approach it this way.
yeah, and she is basically, the child is carrying the, she's very bonded to her mom, and she's carrying the energy of her disappointment, of her betrayal, and
anger.
anger. So that
And
was,
the gums are the anger, Hannah. So we will talk about it in a bit.
so I don't know if you're going to jump in right away in this discussion. I wanted to start discussing a Chinese medicine, but here we go. Anyway, so this was one of our first family constellations. Since then, we've had many, and it is amazing. So
you can, energetic level, you can help to heal the issue, the chronic illness. So unfortunately, we haven't seen this mom ever again. So we wouldn't be able to tell you the end of the story, but we see on other client stories that it's powerful and it really is healing.
So what else in terms of the traditional Chinese medicine? Again, it is aware of emotions, how they influence our body. So for teeth and for gums and, in general, like the bones, the emotion of fear is playing a role in like our field, and everything to do with kidneys and a bladder. It is kind of mastering the quality of teeth, the quality of bone. So we do have several stories with our clients as well. We might have noticed, we might have mentioned here some. There was a person who is working on a train as what is it called? Like
a driver of the train.
Yeah, and it is unfortunately sometimes, quite sad what's happening on the railways. And so that was a woman, and she was very, very distressed by what she used to see, or she was seeing during her life. And that was very stressful for her. And I remember till now how she kept coming and she kept having decays and very problematic gums.
And that's why we knew that it's not only the prevention, the brushing and the cleaning the interdental spaces. So this conversation is for those who listen and who have a great hygiene and they still are dealing with issues.
Yeah. So for you guys, and probably feel you, hear you, because you might be every half year, every 3 months in a dental hygienist chair, and she always goes like, oh my goodness, like what's wrong with you? Well, your gums are not good. Brush, brush, brush. But I actually need to assure you, it's not only about brushing and flossing. It really, the emotions play a key role. And it is very important to address that as well. And it is, for me, now like a common sense, because if you imagine that stress levels and, the fear, the anxiety, what it does, it takes your whole body into acidity, in an acidic environment. And what the acidity does is it takes calcium from like very easily,
from the bones and teeth.
Or teeth. So that's why, we then see demineralization, which means you're losing minerals from your teeth.
And they're
kind of weak, they're softening. It is sometimes very interesting for me how some people have very, very, very soft teeth. So then I am trying to, touch on emotions, touch on nutrition, touch on supplementation, and I'm trying to find out why is that, and, I'm trying to help.
Saying that add towards acidity, that we always with dental hygiene and with dental care, we try to set up alkaline background, which I love to talk about rinsing with salt water, because you are actually smart and you are creating alkaline background for the mouth environment. And you would keep this way the great bacteria, because we are bacteria, we're all of us, it's
we've got millions and trillions of
bacteria. So we would like to keep the great balance. So you're keeping with the alkaline background great bacteria, and the ones which are acidic driven, they would go. So we see beautiful transformations with gums only if people, they would start rinsing with salt water. And we do totally cross the chemicals, which is something we see Or, we used to see, if we're not watching television anymore, we used to see on advertisements all the time, which is chlorhexidine and Listerine.
Alcohol-based.
These chemicals, they would destroy all the bacteria, and in the long term, they would harm you even more.
Yeah, I always say it really in a simple way. There are good bacteria and there are bad bacteria, and they need to be in a balance in favor to good bacteria, obviously, and that obviously then affects your oral microbiome, which is connected to your gut microbiome, and you might have heard about the brain-gut axis. So it does influence our whole body. Our cognition, focus, memory, everything. There are studies which connect the gum disease with heart issues, with Alzheimer's, with autoimmune disease, you name it.
It's the affinity of the bacteria. So we know that certain groups of bacteria, they are more linked to certain organs, and that's why you would see the studies that these kind of bacteria, they're causing urinary blood infection, or these one heart issues. So that's why. And if we have a great balance, we wouldn't have the flow of bacteria flowing in our body. I love to say one more thing, what I say to clients, because we have two groups of clients and bacteria, which is basically, if you have an initial assessment and you see clients who come and they don't have many fillings or none of them, they are more prone to have gum disease issues, because there is two groups of bacteria and they don't like each other. So one is creating the gum disease and periodontitis later on, and the other one more the dental caries. So I know that if we approach the clients who have more aggressive bacteria, or try to balance the bacteria, but if you are more prone to have gum disease, then we would just advise them to really be strict on dental hygiene. You can have your teeth for life, 100 years, and it's actually great that we know about it. You keep going to dental hygiene sessions. You will use ozone. We will talk about it a bit later. And, you basically also, you have nutrition. And I think maybe that will be a next thing we will discuss also together, the nutrition, because emotion is the big part.
Emotion is the big part, but let's maybe just summarize what is actually in the picture. And for you guys, just not to be nervous or stressed about, oh my gosh, so what do? I've got this massive stress in my life right now. I cannot deal with that. I know I can't deal with that in a day. And of course it does happen. Life happens. So we do have a periods of times when, we can't do much, but because of this, we need to know the other resorts we can help ourselves in order to get the things as good as possible. So it's definitely like emotions, like fear and anxiety, stress levels. So let's just, like if we don't have anything which is like really we cannot solve it in a minute, let's just breathe through it. But there are so many things which we are stressing about, like little things, which at the end of the day, they are really little, but we're stressing ourselves with that. So I remember the very good advice that one psychiatrist did advise to Eva. What did he say? Whatever you cannot resolve.
If you cannot resolve others' issues, you don't worry about them.
Or any issues. Even if you know that you cannot do anything about that, just don't worry about that. Yeah. That was just so
profound. Yeah.
Profound.
Yeah. Plus, we would touch on meditation and breathing techniques, which is amazing. So that would be part of healing journey for the gums.
Yeah, exactly. So emotions, stress levels, then kidney imbalances. Yeah. So that's to do with the Chinese medicine. Again, kidneys are associated with bones and teeth. So whatever I can to nourish my kidneys will help bones and teeth. And vice versa. If I do have problems with the kidneys, I need to be aware that, like my teeth can be weakened as well. So again, I need to jump on the next bracket and I need to know, okay, how can I supplement myself? How can I strengthen the kidneys? How can I, add a value to myself with nutrition? So nutrition is another part, with supplementations. And what should I do with the toxins in terms of infection? So that means the brushing and flossing.
Mm-hmm.
And also Yeah, brushing and flossing, oil pulling and others, that's another part. But also toxins in terms of, we were just talking about heavy metals and amalgams and metals in your mouth, which again is just changing the environment in your body. This environment called homeostasis, we were just talking about the acidity, alkalinity, and it can contribute to your, unbalanced microbiome, and then it can create cavity or gum disease. So I think I've just said it all. Maybe the last one we haven't noticed was like a bite trauma. So the bite has
Yeah, that's once people they see gum recession, it's not always connected with gum health, but very often it's with malocclusion, which means when the teeth are not balanced in a way of position, then they would create more tension at the neck of the teeth, and that's why the gum is disappearing.
Yeah. So this episode shouldn't be for you to know that, the decay can happen only because of the sugar, because of the bacteria, and because of, the diet what we eat, which is the, old way of thinking. But it is about, everything we've just noticed. And now what maybe we should just advise like what to do in terms of nutrition and
Yeah, I
supplementation
think
and cleaning.
it's a big part, supplementation, because past 3 clients we have measured for vitamin D. We were testing them for levels. They were very low. So there is no wonder that then they don't heal and they don't feel well and they feel anxiety and they look for
They don't have energy.
psychiatric help, and it reflects in their mouth as well. So we pay attention to supplementation. Well, some clients would choose Chinese medicine herbs. Some clients, they would choose vitamins created. So we do advise combination of vitamins and minerals. For gums especially, it's collagen and vitamin C and everything which is a friend with vitamin D3, which is actually a hormone. So all the friends, K2, magnesium and
The
zinc.
supplements are actually for another episode, but it is very important to supplement, like especially when we talking about amalgam removals or implantations or implants or surgeries, wisdom teeth removals. But it can be even when you are a sportsman and you having, extreme, or even not a sportsman, our nurse, my nurse, she runs every day to work and
she's
back.
not professional, but she's semi-professional.
Yeah,
right.
It's
So
like
she has
10K running
each
way. It's like a half marathon every day, every single day. So she needs to make sure that she's got, her mineral balance well done. As a matter of fact, one of our treat was like, we were just giving a team a new supplement we started to use, which was D3K2 and magnesium and some proteins. And she said how well she sleeps now and how energetic she feels, which is amazing. So, not only it helps you with bone and teeth, but like vitamin D is miraculous. It's, I think they say it is, in charge of, 200 of regulative functions in the body, immune system and others, where, it helps us.
Yeah,
So
and I'm
it's
glad
very
that you notice sportsmen, because we're fortunate in our clinic, we have a great sportsmen as well. And they, especially this one, I remember she was sharing that her friends, like professional athletes, they have lots of issues with teeth. They have cavities, they have soft teeth, and they had to start paying attention to nutrition in sense of supplementation, because you're missing building blocks for in order to the body to heal, because you don't have the building stones, then you don't heal. And I like to say this S symbol, because S is stress. So when you have stress, you need more of you need more of minerals and vitamins. If you have sports, that's the same thing. Then there is smoking, sugar, and
what's the last one?
Yeah, so we have 4 now. So let's think about the
Now we're going to keep thinking about the
Yes.
last one. Yeah, anyway, you reminded me another sports woman I've had recently, I don't know, half a year ago. And she was a young woman who used to because now I've seen her recently, she stopped, but she used to run 800 meters professionally. And what I was very, very surprised, or maybe not surprised, when I can't remember if we were removing amalgams, maybe not even that, but cavities, and how brittle she's had her teeth. That was just so soft. So obviously my first question is, what's your nutrition? What's your
Stress levels,
supplementations?
sports levels. Yeah.
Exactly. And it was good to know that she hasn't started from the day one when she started the sports, but she said past 4 years she's working on it. She's supplementing. She's got a professional advice, which is great. But again, I was just telling her, you can't assume that, you've been like training as a professional for 15 years and that the thing's going to resolve in like first four. Sometimes the body just needs some time to recover, because she's kind of impatient, and she said, okay, I've got symptoms such and such, and I supplement. Now she stopped training and she expects that everything's going to resolve right now. But yeah, I always have a compassion with people. And also I do advise all of them that we're all human and everything needs time, basically, and patience and compassion towards ourselves. And yeah, I think the patience.
And I have experienced that the new cavities, as a matter of fact, there is something behind it, and it's not really the prevention, which is flossing and brushing, because that's what we do years the same way, even if we do it super well or if we don't do it at all. But what changes is the levels of vitamin D, for instance. So if we see clients regularly every year and we would find new cavities, which is not very often, but we do, then we question this and we measure the vitamin D level, and we're not surprised that we find the levels are very minimum.
Yeah.
So, yeah.
So maybe let's add some more stories, and I probably feel like that we're gonna keep the information how to, brush and what are the tricks and the technique for the next episode. So I'm thinking about more stories. We started about this story, like the sportsman stories, but also the lady who's had inflammation in her gum front tooth, which is connected with her kidneys and bladders. But I'm also seeing in front of me several, it's mainly women, because we women are the givers, the carers. And from the emotion perspective, even the feelings of underappreciation or being alone, handling everything on my own, inability to defend, and I am here and I need to kind of look after everyone and it's only me. That's got a massive effect on your gums as well. So I remember several ladies, like in their 50s mainly, where the destruction of their gum and then bone was quite severe. And yeah, we like to often just whatever we feel like we can, start the discussion and encourage them and empower them in this way as well, and explain to them that not everything is about brushing and flossing, that also there's emotion involved. There are techniques which can, even your unconscious stuff can bring up. So I always recommend that, from either hypnosis to family constellations to EMDR or tapping EFT or
body coding.
I've just been to craniosacral massage yesterday.
Yeah,
so
the
things like
energetic
that.
therapies.
Yeah. Because the emotions really do influence us a lot. We might not be even aware how complex it is. And what also I remembered in terms of gum inflammation was like autoimmune diseases I have. You don't necessarily need to have full mouth of metals. We see that quite often when people come with rheumatoid arthritis or Hashimoto's or any other like Crohn's disease. And we see that they do have full mouth of metals or like amalgam fillings or metals, which has got a massive effect on microbiome and your whole body. But also we see gum issues. I remember a lady who's had issue with it's always for us, we're like sometimes detectives, but it is weird if we do see one tooth which is having like a deep gum issue. We call it like a pockets, but deep gum issue, like an inflammation. Obviously, we do check technically if there's not like bite involved and whether there's any like a trauma in terms of like the teeth connection, but there wasn't. And before we did this examination, I was asking about the whole body, like issues she was having. And she said she's having issues with her thyroid gland. And again, when I see the chart in front of me in my head, I see, okay, well, the first molar in the upper jaw, well, that's leading straight to the thyroid gland. So again, if you do have a issue in the thyroid gland, that can weaken the whole path, the whole meridian. So every single thing, part of the body, part of the spine, which lies on the meridian, and vice versa, that the gum issue can weaken the thyroid. So it's not only one-way road, it's a two-way road. So so we started to, look after the gum, clean it, ozone, several sessions, and everything has improved a lot. So I remember she said after a few sessions, she's had a check and she said the blood levels were much better. So it is saying, right, Eva? You've had some nice
well, I was going
experiences?
to, yes, but I was going to share in the next episode because I would like to talk about inflammation around wisdom teeth. And that's a big bag of information. So
that's going to be longer.
I think we would end this session and this episode, and we will hear you in a next episode.
Yes,
we will continue with gums and inflammation and cavities and prevention and flossing and emotions. So we will continue in next episode.
So remember, everything's interconnected, but also the best doctor is within us, right? Be safe, and we'll see you in the next episode.
Thank you for joining us on Healing Through Dentistry podcast.
We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.